Hello, I'm Dr. Rhonda Johnson. Today is Wednesday, July 10th, 2024. Well, by now, most people have heard about Project 2025. Today, I am going to review some of the proposed changes to healthcare under Project 2025. Now, this is part one of a two-part series. I hope that you will listen, and I hope that you will share. Now, I took the time to read that Project 2025, all the health-related information that was outlined. And I'm going to share verbatim from this report, and then I'll summarize my opinions at the end of part two. So on page 4 to 5, it reads, the next conservative president must make the institutions of American civil society hard targets for woke culture warriors. This starts with deleting the terms sexual orientation and gender identity, deleting diversity, equity, and inclusion, gender equality, deleting gender awareness, gender equity, gender sensitive, deleting abortion, reproductive health, reproductive rights, and any other term out of every federal rule, agency, regulation, contract, and piece of legislation that exists, folks. That's what it says. On page 62, it reads, eliminate central promotion of abortion, eliminate comprehensive sexuality education, and the new woke gender ideology, which has as a principal tenet gender affirming care and sex change surgeries on minors. On page 133, it reads, dismantle the Department of Homeland Security. On page 147, it says, create an authority to expel illegal aliens across the border immediately when certain non-health conditions are met, such as loss of operational control of the border, citizens, and interests. On page 191, it says the next administration must end blind support for international organizations. If an international organization is ineffective or does not support American interests, the United States should not support it. Examples they give include the World Health Organization and the United Nations Human Rights Council. On page 290, it says Congress must limit the Department of Agriculture's role. On page 309, it says work with lawmakers to repeal the dietary guidelines, and the USDA should help lead an effort to repeal the dietary guidelines. So I'm going to continue with this document on part two. So please look at part two.